Hey guys, this is Dr. Sean of the Natural BodyWorks, and today we're going to go over whether or not weather can give you joint pain. So, you've heard of probably barometric pressure, and that the weather changes can cause joint pain, like back pain, neck pain, shoulder pain, elbow pain, knee pain, that kind of stuff. Well, it's considered a wives' tale, and it's completely considered by Western medicine, which would be the Western medicine we're used to at hospitals and things like that, considered to be complete malarkey, but it's not. And I'll explain to you why. So, here's what barometric pressure. Barometric pressure is the pressure of the air that is pressing on you right now. We don't feel it because we've gotten used to it, but it's about 760 millimeters of mercury, Hg. Hopefully you can see that. 700 millimeters. It can move mercury 760 millimeters. That's how much pressure is at sea level, right? So way down here at sea level, it's 760. As we go higher up, towards the mountains, where I am, okay, there's me right there, and where I am is probably about, I don't know, 640 or something like that, 740 probably. It's not much different, but it is enough to make a difference. Now, one of the things that you notice happens is when you have a little air pocket in your ears and you fly up in an airplane, especially when it's unpressurized, you get the pressure and you have to, equalize. That's getting it to pop, basically. Now, you can also hear it when you do those kind of things. That same thing, that's pressure release of gas that's held in the joint space. Okay, it's just a cavitation is what it's called, means it makes an open space and then it collapses and you hear it pop. Now, how can that cause joint pain? Well, we have to go a little bit further in that. Now, we know that, hang on, let me erase this. Now, I'm going to talk while I'm erasing it though. But in divers, we have a couple things called the bends or caissons disease. And what that means is if you have, like, here's the surface of the ocean, okay? And here, I'm going to go back over there. Here's the surface of the ocean, and here's the bottom, and here's, some little starfish, whatever, and here's a shark, right, and all those guys down there. So there's little critters, here's a fish, all that kind of stuff. And then what happens is we have, remember, 760 millimeters or 760 centimeters, or 76 centimeters of movement of that mercury can move in that little graduated tube, Boyle's law and all this kind of stuff, buoyancy and all these kind of things, has to do with the amount of pressure and air and these kind of things. Now, pressure is pushing down on top, here on top of the thing, remember 760, it's called 1 atmosphere, okay, is sea level, is 1 atmosphere. Now you go deeper, down to 33 feet, 33 feet, right here, and that's going to be 2 atmospheres. 66 feet is going to be 3 atmospheres. Okay, we'll just circle them like that. And here's what happens. If you take a normal breath and you dove down on compressed air, which is the air you have in your scuba tank, your self-contained underwater breathing apparatus, when you breathe air in, you breathe in a certain amount. And let's say it's 1 liter of air, about this big, maybe that big of a good breath, right? Now let's pretend that that's this size. When you're here at 66 feet, actually is what it is, 66 feet. So that this one little bubble of air, this big inside you, if you held your breath and shot to the surface, when you get to 33 feet, it would be about twice the size. That's not good. Especially if it's stuck somewhere like a lung or in a blood vessel or in your brain or in your lung. You get what's called the bends, you get caissons disease. It's a very bad thing, and we want to get those people some emergency care and get them repressurized, which they do, like send them down again in a diving bell, or send them to a decompression chamber or something like that. So there we go. That's how it works in diving. Now, why do I know that? Because I was a dive master for like 10 years, and I've dove all over the freaking place, and I've done tons of diving. And you do the dive tables, and you make sure you don't get this, and you don't follow you don't pass your bubbles when you go up. That's the only way to do it. Make sure you follow your charts and your computers and all of these kind of things. But what happens on the surface for us land lubbers? So, one of the things you do when you watch TV, you're watching the news, you watch something called the weather. And the weather will have like your map, right? So here's the United States, and there's Texas, and California, and whatever, close enough. Don't forget Michigan, all those guys. So here's the United States. I know it's over on this side, but bear with me. And you'll have these like circles like this, and then maybe whatever, and they'll be at L, okay? That L is low pressure. That means that the pressure relative to the other areas is lower. When that happens, just like when you go up in an airplane or you drive your car up into the mountains and you have like a bag of potato chips in the back, or you have a water bottle in the back that's been used and you closed it up, as you go from a heavier pressure down low and you come up lighter pressure as you go higher in the atmosphere, which is higher on the ground, right? That little air in that chip bag will expand. And it can get so big it almost seems like it wants to pop. It won't usually pop, but sometimes I guess maybe it does. I've heard it before. But the pressure will change. It decreases as you go higher. Same thing. The pressure decreases for whatever reason, weather or stuff like that, as the air moves out and gets heavier and all this kind of stuff. We have different pressure gradients. When a storm's coming, the pressure drops. That's the low pressure front, right? When the low pressure drops, erasing again because it's easier for me to do and talk. When the low pressure front comes in, I'm going to draw you a joint and show you what happens. So let's take the knee, okay? So here's a knee. This is the lower part of the knee. It's called the tibia. And here's over here is the fibula. This is like the knee, and here's be the kneecap right here. And we're going to draw this and go up this way. Now this is the femur, which is your thigh bone, okay? This can also happen in muscles, and we're going to go over that in a moment. But around the joint, this is the joint here, this is the knee joint, okay? You have a little capsule that goes like this and goes like this. And it covers the whole thing. It surrounds the whole thing. It's like a little liquid-filled bag around the joint. But in here, we have a thing called the meniscus. And this is the other part of the joint where these two guys rub together. This kind of cartilage called hyaline cartilage is the most common kind of cartilage. You have this kind that breaks down really easy and get injured really easy. But you also, in old injuries especially, or in other places where there's scar tissue, or perhaps even just normal, you get these kind of crunchies like this, you may have bubbles. Now that little tiny bubble that's inside there, I'm going to put a little bubble like this. I'm going to just draw a little circle right there like that. Okay? Imagine that's an air bubble. Here's that. Okay? If that's a little tiny, and we're talking microscopic, guys. We're not talking big ones. When the pressure outside drops, this wants to expand. Okay? So as the pressure drops, it gets bigger. That presses on tissues, which stimulates nerves to tell you, hey, something's wrong there. The muscles will stiffen up around the knee, and we may even get creaky feelings, which can be called crepitus if it's a lot, but it's usually just a creaky kind of feel. And you have pain, okay? This gets a lot of people to come into my office. I've been doing this for over 20 years, and it was Harvard Medical School did a study, and they basically said that anybody who says that they have this is either lying to you, or they're malingering, which means they're faking it, or they're just mistaken, because it doesn't happen. I'm here to tell you that it actually does. Now, here the problem is, when the study was done, in Australia and Europe and United States, I believe, they did thousands of studies of visits to either orthopedic doctors or rheumatologists or who have you, that kind of thing. And I don't think they even asked them, but none of them complained and said, hey, the weather's changing, my knee hurts. Or they also looked at how many rainy days there were versus pain, because it would make sense that as pain increased, or as rainy days increased, you would see more pain people, right? Yes and no. One, because people don't usually come in and say, you know what, it's going to rain, especially to their medical doctor who's going to poo-poo the idea anyway and tell them, boy, you're just such a country bumpkin, you don't know what you're talking about. But I hear it all the time. People come in and they say, yep, I think a storm's coming, my shoulders are starting to bug me. And this is a common, typical thing for that person. Now me, I do notice changes in my wrists. I've had injuries in my wrists, and I know that those can cause problems when the weather changes, is about to change, usually about the day before. I'll sense it. Now, inside a muscle, it can do the same thing. So let's take a typical muscle. A typical muscle looks like this, okay? And we have like this. It has a belly, and it has an origin and an insertion. And an insertion is the point where it leads into and pulls from, or pulls at. And then the origin is where it starts. Usually those are more in the middle of the body, or what's called proximal is towards the center, or whatever, towards the torso. And if you take this muscle here, this is the bicep, we have an origin, which is up here, okay, and then we have the insertion down here, and it pulls this way, okay. So that's what a basic muscle looks like. Now there's fibers, and there's a lot of spaces in here. And these fibers go whatever, like this, something like this. And you might have those spaces from a scar, from an old strain, from an old injury, sometimes just naturally, and you have a little tiny air pocket or a little open pocket in there. That little tiny open pocket is subject to the pressure changes. When the pressure drops, that pocket will get bigger. Now usually your body diffuses all that stuff through. Same thing like with scuba diving, for example. We talked about going down in depth. Usually what you're doing is you're absorbing and diffusing into your system, into your bloodstream, nitrogen. Nitrogen is inert. You don't usually exchange it with anything, so it just kind of hangs out and it can collect and you get a little bubble. And if you don't take the time to properly get things moving, that bubble can get stuck and expand as you ascend. Same thing. As the pressure drops, that bubble expands. Fortunately, we do breathe enough. Hopefully, breathe, you should. And we move enough, okay? Motion is life to the joints, and motion is life to everything. But anyway, you're able to diffuse that nitrogen or that carbon dioxide or whatever the gas is back into the system so they can be held in suspension and then released when you breathe out. Now, if that doesn't happen, it causes pain. It causes this muscle to tighten up. That muscle tightens up, feels stiff. Sometimes that pulls on the joints can make the joints feel stiff. Sometimes that pulling on the joints can make them tight and creaky. So when you're going up the stairs and your knees are popping and your ankles are popping and all that stuff, I think the worst news that you can get from anybody is, well, you're not going to be a ninja because you can't sneak up on anybody. You're popping and snapping and crackling and stuff. You're making enough sound effects that you should be your own cartoon. So what do we do with that? Well, one, go ahead and hit the like button because we're going to go over the rest of this stuff real quick. But I want you to give me the like button and give me a comment if you've had this kind of thing and what did you do about it? Because I'm going to tell you what to do in just a second. But subscribe first. So what do you do about this kind of pain that happens just before it rains or just before it snows or just before the weather changes? Well, you can always keep warm. Is always a good thing. Now this is out of traditional Chinese medicine or what we call acupuncture theory because we're dealing with the energies and some other factors that we don't really appreciate in Western medicine, and we can actually find the better explanations in the Eastern forms with the yin and yang and stuff like that. But we want to keep movement and we want to keep warm. Okay, warmth will help open up the tissues and allow blood flow to flow through. That's what we need. Now, motion is life to the joints. Motion is life to everything, actually. Motion is life to your breathing. If you don't breathe, if you don't move air, you're going to pass out and die. If you don't move your blood, you're going to die. If you don't move your bowels, you're going to die. All this kind of stuff. So if you don't move your body, it's going to start tightening up. And we want to reduce and improve our range of motion in the pain-free zone, which means where it doesn't hurt. Right? If it hurts to do this, don't do this. Do it almost to it and kind of start to push. This is how you can end up with things like frozen shoulder and arthritis of the knee and neck and head and all this kind of stuff. And we want to keep things moving. So keep it moving, guys. And anyway, that's really the biggest thing. Now you can also get things like adjustments, and you can do some acupuncture, and you can do some massage stuff and things like that. So the adjustments or the mobilizations or something like that are done by somebody else who's using your, they're trying to open this up, and sometimes you get what's called a cavitation, which is the popping sound. Is that popping sound bad? No. Don't force it. Don't let anybody force it too much. If you're fighting it, there needs to be some more relaxation first before you get in there. Don't ever push on this and grab yourself by your hair. That's why I don't have any hair, so I can't pull on it. We don't push and pull on it to make it happen. If you stretch and it does open, that's fine. Give it a moment. You may need to stretch some more. Anyway, this is Dr. Sean over at the Natural BodyWorks. You guys take care. And don't forget to watch the rest of the videos.